If your knees grumble when you stand, if jars fight back or stairs feel steeper every week, this is for you. Joint pain isn't just getting old. It's often a slow burn of inflammation that makes cartilage stiffer, synovial fluid stickier, and mornings tougher. Today I'll show you 7 everyday foods that can help calm that fire so you can move with more ease in as little as 2 to 4 weeks without complicated diets or pricey supplements. Here's the promise: by the end, you'll know exactly what to eat, when to eat it, and how to build a 60-second anti-inflammation bowl you can make tonight. Stay with me because food number 7 is the surprising one few people use, and it might be the easiest win. Quick safety note before we dive in: this video is educational and not medical care. If you're on blood thinners, have kidney or gallbladder issues, reflux diabetes, or food allergies, check with your clinician before making changes. And pattern interrupt: it's not just turmeric. Inflammation responds to a pattern of eating omega-3s, polyphenols, fiber, and the right fats working together like a brake on an overactive immune response. I'll give you simple swaps for breakfast, lunch, and dinner. Before we start, tell me in the comments where you feel it most: knees, hips, or hands, and type relief if you want the printable 7-day menu. Ready? Let's open your kitchen, not your medicine cabinet, and turn meals into daily joint care. I'm a nutrition-focused health researcher, and this channel turns current evidence into senior-friendly food-first guides you can actually use. No miracle pills, no hype, just meals that stack small wins. Everything here is educational. It isn't a substitute for medical care. Safety first: if you take anticoagulants, manage kidney disease, gallbladder issues, diabetes or reflux, or you have food allergies, confirm changes with your clinician. We'll stay with culinary amounts. No supplement dosing in this video. The best way to use what you're about to hear is simple: watch once for the big picture, then replay and pause at each food to grab screenshots of the shopping list and quick recipes. Try one swap per meal, track your morning stiffness and stair climbing comfort for 2 weeks, and come back to the comments with your wins. If you want the printable 7-day menu and the anti-inflammation bowl, type relief, and I'll make sure you get the link. Let's make joint inflammation easy to understand. Picture a neighborhood with too many alarm bells. As cartilage thins with wear and tear, tiny fragments and stress signals irritate the synovial lining, the slick tissue that lets your joint glide. Your immune system sends chemical messengers, think interleukins and TNF, that call in help. That's useful in the short term, but when the alarm stays on, fluid thickens, tissues swell, nerves get more sensitive, and you feel stiffness, heat, and ache, especially in the morning or after you sit. Food won't cure arthritis, but it can turn the volume down on that alarm. There are 3 big diet levers to know. First, omega-3 fats, like EPA and DHA from fish and LA from plants, which help counter those pro-inflammatory signals. Second, polyphenols from plants, those colorful compounds that act like tiny shields against oxidative stress. And third, fiber and steady blood sugar, which blunt spikes that can amplify inflammation. When your plate leans toward these, you create a daily nudge toward calmer joints, less morning creak, easier stairs, better grip. With that in mind, let's hit food number 1 you can cook tonight in about 15 minutes. Fatty fish, salmon, sardines, trout top our list. They bring marine omega-3s, EPA and DHA nutrients that help counter inflammatory signaling in sore joints. You also get vitamin D for muscle support and balance. And if you choose canned salmon or sardines with bones, a gentle calcium boost that pairs well with movement to support joint health. Here's a 15-minute sheet pan dinner toss: 2 cups of mixed veggies, broccoli, zucchini, bell peppers, with a tablespoon of extra virgin olive oil, lemon pepper, and a small pinch of salt. Spread on a sheet pan. Nestle 2 salmon fillets, skin on top. Brush with a teaspoon of olive oil. Sprinkle garlic powder and dried oregano and roast at 400 degrees, or about 205 degrees, for 12 to 15 minutes until the salmon flakes. Finish with lemon and chopped parsley. Aim for 2 servings per week. On a budget. Keep canned salmon or sardines in the pantry for quick salads or whole grain toast. Prefer a milder taste. Try trout or salmon burgers. Senior smart tips. Rinse canned fish under cool water to reduce sodium and mash those soft bones in canned salmon or sardines. They're an easy calcium source. If you take blood thinners or have seafood allergies, check with your clinician. Not a fish fan? Don't worry. Plant options are coming. Food number 2 is extra virgin olive oil. Good EVOO is rich in polyphenols, including a compound called oleocanthal that behaves a bit like a natural aspirin, helping quiet pathways that irritate joints. The simplest move most people can make this week is to swap EVOO in for butter or refined seed oils. Small change, big pattern shift. Make a 60-second anti-inflammatory dressing in a jar. Add 3 tablespoons of EVOO, 1 tablespoon of lemon juice, a teaspoon of Dijon mustard, 1 small grated garlic clove, half a teaspoon of dried oregano, and a pinch of salt and pepper. Shake and you're done. Drizzle over greens, grain bowls, roasted veggies, or spoon over grilled fish. Aim for 1 to 2 tablespoons per day as your default cooking and finishing fat. For sautéing, keep heat below about 350 degrees. Medium heat to protect flavor and nutrients. Then finish soups, fish and steamed greens with a spoonful for that peppery bite. Shop smart, choose a dark glass bottle, look for a recent harvest date, and store it cool and away from light. If you're on a fat-restricted plan for gallbladder reasons, simply use smaller amounts. EVOO still has calories, so pair it with plenty of vegetables and lean proteins to support joint-friendly weight control. Food number 3: berries, blueberries, blackberries, strawberries. Those deep colors signal anthocyanins, pigments that act like tiny bodyguards against oxidative stress and inflammatory signaling. Berries also satisfy a sweet tooth with fiber and a gentler glycemic impact than cake or cookies, good for blood sugar and weight, 2 big drivers of joint comfort. Try these 2 fast snacks. First, a berry walnut cup, 3/4 of a cup of mixed berries with 2 tablespoons of walnuts. Second, berry Greek yogurt, 3/4 of a cup of berries with half a cup of plain Greek yogurt and a shake of cinnamon. Both deliver polyphenols, plus protein or healthy fats for steady energy. Target 3/4 to a full cup most days, fresh or frozen. Frozen berries are often picked at peak and are budget-friendly. Stir them into morning oats, sprinkle onto salads, or blend into a kefir smoothie. Diabetes-friendly tip. Pair berries with protein or fat yogurt nuts, or cottage cheese to blunt glucose spikes, and if you track, notice how your numbers respond. Shopping smart. Choose deeply colored berries and wash just before eating. If your budget allows, strawberries are one fruit where many people choose organic due to higher pesticide residue, but any berries beat no berries. Food number 4 is leafy greens, spinach, kale, arugula, collards, spring mix. Greens bring magnesium, which helps muscles relax, vitamin K for bone and cartilage support, and natural nitrates that can enhance blood flow to working tissues. Their fiber also feeds a healthier gut, and a calmer gut often means a calmer immune system. Try warm garlicky greens in 4 to 5 minutes. In a skillet over medium heat, warm a tablespoon of extra virgin olive oil. Add a sliced garlic clove and cook 30 seconds. Pile in 4 cups of chopped spinach or kale with a pinch of salt and pepper and a tablespoon or 2 of water. Toss with tongs until wilted, about 2 minutes for spinach, 4 for kale. Finish with lemon juice, and if you like, a sprinkle of crushed red pepper or a light dusting of Parmesan. Aim for 1 to 2 cups, cooked, or 2 to 3 cups raw most days. Rotate varieties to diversify nutrients and keep things interesting. Senior smart tips. If you've had calcium oxalate kidney stones, prefer lightly cooked spinach and rotate lower oxalate greens like arugula and romaine. On warfarin, keep your leafy green intake consistent and coordinate with your clinician. For easier chewing, slice kale thin and massage with a little EVOO and lemon to soften it up for salads. Food number 5 is the power duo turmeric and ginger. Curcumin from turmeric and gingerols and shogalls from ginger work on complementary inflammatory pathways. Used regularly in food, they may ease morning stiffness and post-activity soreness. Think of them as daily background support, most effective as part of your overall anti-inflammatory plate. Try a daytime golden ginger latte. In a small pot, warm 1 cup of milk, dairy, or fortified unsweetened almond, soy, or oat. Whisk in half a teaspoon of ground turmeric, half to 1 teaspoon of freshly grated ginger, or a 1/4 teaspoon. Ground a 1/4 teaspoon cinnamon, a small pinch of black pepper. Important for curcumin absorption, and a half teaspoon of honey or a few drops of stevia to taste. Heat gently to steaming, don't boil. Optional, add a teaspoon of extra virgin coconut oil or a small splash of EVOO to help absorption. Sip mid-morning or afternoon. Beyond the latte, stir, turmeric and ginger into egg soups, roasted vegetables, and even morning oats. Aim for culinary amounts daily, rather than large supplement doses. Cautions: if you have gallstones, GERD, or you take blood thinners or diabetes medications, stick with food level use and check with your clinician. Spicy blends can irritate reflux. Start small, pair with food, and see how you respond. And yes, turmeric stains. Use glass or steel tools and wipe spills quickly. Food number 6, nuts and seeds. Walnuts, flax, and chia. They bring ALA, omega-3s, magnesium, and fiber, a trio that nudges down inflammatory signaling while supporting weight management and steady energy. The key is consistent small portions. Make joint calm oatmeal in 3 minutes. Microwave or simmer a half cup of old-fashioned oats with 3/4 of a cup of water or milk. Stir in 1 tablespoon of ground flaxseed or chia, 2 tablespoons of chopped walnuts, a dash of cinnamon, and a half cup of berries. Finish with a teaspoon of honey if you like. That's polyphenols, omega-3s, and fiber in 1 bowl. Most days include 1 ounce of nuts, about a small handful, or a tablespoon of ground flax or chia. Sprinkle them on salads, yogurt, or cottage cheese, or blend into smoothies. If you have a sensitive gut, soak chia 10 minutes in liquid before eating. Senior Smart Tips: choose unsalted nuts to support healthy blood pressure and store nuts and seeds in the freezer to protect delicate fats. If you're on blood thinners, keep portions consistent and check with your clinician. If chewing is tricky or you use dentures, go for ground nuts and seeds, or a walnut butter for easier texture. Food number 7. The sleeper is fermented foods. Your joints don't inflame in isolation. Your gut immune axis helps set the thermostat. Fermented foods like plain yogurt, kefir, sauerkraut, and kimchi deliver live cultures and postbiotics that support a healthier microbiome. In some studies, adding even 1 serving per day was linked with lower inflammatory markers, making this an easy, low-cost habit that plays well with all the other foods. Build a berry kefir parfait in 2 minutes. In a glass layer, 3/4 of a cup of plain kefir or unsweetened yogurt, half a cup of mixed berries, a tablespoon of ground flaxseed, and a dusting of cinnamon. Optional, a few chopped walnuts for crunch. That stacks probiotics, polyphenols, omega-3s, and fiber, exactly what sore joints like. Aim for 1 serving of a fermented food daily. Choose plain, low-sugar dairy or naturally fermented vegetables. Look for refrigerated raw or live cultures on the label. Watch sodium in kraut and kimchi if you manage blood pressure. A quick rinse can help. If you're lactose-sensitive, kefir and yogurt often sit better than milk, but start small. And if you're on certain immune-suppressing therapies, ask your clinician before increasing live culture foods. Food works best when your daily rhythm supports it. Here are 5 lifestyle boosters that multiply the benefits. First, movement snacks. Every few hours, do 1 minute each of sit-to-stands, heel raises, wall push-ups, hip hinges, and ankle pumps. 10 minutes total over the day keeps joints lubricated and blood moving without overloading sore areas. Second, protein pacing. Aim for 20 to 30 grams of protein at breakfast, lunch, and dinner. That could be eggs or Greek yogurt in the morning, fish, chicken, or beans at midday, tofu, tempeh, or lean meats at dinner. Even distribution helps your muscles stabilize joints and reduces that end-of-day wobble. Third, hydration timing. Sip a half to 1 cup of water or herbal tea with each meal and 1 between meals. Dehydration thickens synovial fluid and worsens fatigue. If nighttime urination is an issue, taper fluids in the last 2 hours of the day rather than avoiding them altogether. Fourth, sleep routine. Dim lights 60 minutes before bed. Keep the bedroom cool and wake at a consistent time. Poor sleep nudges inflammatory signals upward. Small rituals, light stretching, and a few minutes of nasal breathing help. Fifth, stress micro resets. Do 3 cycles of 4-4-6 breathing, inhaling, for 4 holding, for 4 exhaling, for 6 before meals or during a flare. Lowering that fight or flight response can reduce perceived pain. A quick medication note. Some drugs like NSAIDs, PPIs, statins, and diuretics can affect nutrient levels or GI comfort. Coordinate diet changes with your clinician, especially if you use blood thinners or manage diabetes, kidney, or gallbladder issues. Now let's assemble the 60-second anti-inflammation bowl you can make any night of the week. In a large bowl, add 2 cups of mixed greens. Top with a half cup of cooked salmon. Leftovers are perfect, or if you prefer plant-based, 3/4 of a cup of white beans. Add a half cup of berries, 2 tablespoons of walnuts, and a tablespoon of pumpkin seeds if you like. Toss in a handful of herbs, parsley or dill, then drizzle 1 to 2 tablespoons of that eau lemon dressing we made earlier. Finish with a crack of black pepper and a squeeze of lemon. In one meal, you've stacked omega-3s, polyphenols, fiber, magnesium, and those absorption-friendly fats. This bowl is flexible swap salmon for sardines, switch berries for cherry tomatoes when you want savory, and rotate greens so you never get bored. To help you take action, here's a teaser of the 7-day starter menu. Monday, sheet pan salmon with garlicky greens. Tuesday, turmeric ginger lentil soup with an arugula salad, dressed in avocado and lemon. Wednesday, chicken or tofu veggie, stir-fry over brown rice, and a kefir parfait for dessert. Thursday, sardine whole grain toast with a tomato, olive, and basil salad. Friday, baked trout with roasted vegetables and a yogurt cucumber side. Saturday, a bean and berry power salad with walnuts and that olive lemon dressing. Sunday, a spinach mushroom omelet flavored with a pinch of turmeric and black pepper with berries on the side. If you want the printable PDF with the full recipes, a shopping list, and a 2-week tracking sheet for morning stiffness and stair comfort, type relief in the comments and hit subscribe so you don't miss updates. Let's land this with a quick checklist. You can screenshot 2 fish meals per week. Avocado as your default fat. Berries most days. Leafy greens daily. Turmeric and ginger in something you already eat. A small serving of nuts or seeds. And 1 fermented food per day. Add movement snacks. Pace your protein sip. Steadily protect your sleep. And use those 4 to 6 breaths when stress spikes. Remember, this is food first support, not a cure, and your progress will be steady, not dramatic. But stacked together, these choices can make mornings easier, stairs friendlier, and jars less stubborn. If this was helpful, tell me where you feel it. Knees, hips, or hands, and what swap you'll try first. Type relief if you want the printable plan. Here's to calmer joints, stronger days, and a kitchen that works like daily joint care.